I want to rejuvenate my face a bit without going under. What treatments would you recommend? I have had Botox and fillers in the past. I'm interested in the Vampire Lift, or anything for overall improvement. I'm not looking to look 20 years younger.
Thank you for your question. You submitted a question with the photo, and you're basically asking how to improve your appearance or to rejuvenate your face without going under. So you don't want to go under anesthesia. And you've also described having undergone Botox and fillers in the past, and that you're considering the Vampire Facelift, and you want to do something to basically look somewhat younger. However, you're not trying to aim for something as drastic as 20 years younger. Well, I can certainly help you understand how I approach this question, which comes up in my practice every day. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and you are certainly asking a question in a time when there are a lot of options, and this is a time in our history of this field where there is almost a tug of war between different ways to approach a problem without having a clear understanding of the principles. So basically, you often see a lot of messaging for different devices, different brands, different names of procedures, different names for different injectables, and certainly can get overwhelming. So basically, I'll just give you some overall understanding as to how I approach essentially what you're describing as a facial aging issue. And so when you think about facial aging, there are basically two things that happen with facial aging. There's volume loss, and there's descent and sagging. Now, in addition, there are also things that happen that affect the musculature of the face, what affects the volume of the bone, muscle, fat, soft tissue of the face, what affects the skin of the face. So when you ask a question about the Vampire Facelift, let's just get a clarification of what benefit this provides, and then think about what level that may be able to make a difference for you. Vampire Facelift is named because it involved the combination of platelet-rich plasma, which is derived from your own blood, to help stimulate your skin quality in a way that restores a lot of glow and vitality to the skin. And that's something that's done with PRP. PRP, again, platelet-rich plasma derived from your blood. It is a combination of PRP with a single syringe of an injectable filler, such as a hyaluronic acid filler like Restylane or Juvederm, placed very strategically in different places so that a person can look overall better. But it's a single syringe. So I can tell you that when it comes to addressing the challenge of doing something that's non-surgical, I think that there's a real opportunity to really make a significant impact with a couple of different modalities. Number one would be restoring volume, something called structural volumizing. And this is different than what is usually done with restoring volume in the face. In the traditional approach to facial aging, the approach is to chase the lines and wrinkles, which is not bad, but it certainly is only one element, as well as adding volume in soft tissue. Now the challenge there is you can try to soften lines and wrinkles and you'll make an impact. You can add a little bit of volume to the soft tissue, but will there be enough of an improvement? That's the open question. When we do something called structural volumizing, we're actually placing long-lasting fillers such as Juvederm Ultra Plus or Juvederm Voluma at the level of the bone structure, in between the muscle and the bone, in a way that restores some of this bone loss which occurs with facial aging. It's a very important factor that is really underappreciated. People don't realize that the bone structure actually diminishes with age, and a few millimeters can actually be very, very significant in terms of the volume loss. With structural volumizing, we restore volume typically in the cheekbone, the jawline, the chin, and restore a lot of the things that people really see as defining a youthful appearance. There's something known as the golden ratio, and this is something that really is important, where the upper part of the face is at 1.6 proportionately to the lower part of the face, which is at 1, a ratio of 1.6 to 1. A youthful face has that ratio. And as people get older, that ratio changes, and actually the lower part of the face gets wider. So structural volumizing, I would say, would be my approach from the foundational level. Then at the soft tissue level, there is opportunity to soften some lines and wrinkles with a variety of fillers such as Restylane, Juvederm as well. And now that creates volume in certain areas at the level that's basically just below the skin. And then when it comes to the finer lines and some of the more the lines that are resulting from dynamic activity of muscles, such as the muscles in between the eyebrows, often referred to as frown lines, this is where neurotoxins like Botox and Dysport have a tremendous benefit and value. And so with strategic placement of neurotoxins to treat different areas of the face, you can look natural, remain naturally animated, so you don't worry about looking too stiff and unnatural, and that can also address some of those areas. Last but not least is improving skin quality and texture. And this is where the PRP from the Vampire Facelift concept does have a potential value. It improves skin quality from within, and in a way that nothing else does create, unlike PRP. And then coming back to the more superficial levels of the skin, there are a lot of different devices and chemical peels and other things to help improve the surface of the skin. Anything from fractional laser, non-ablative laser rejuvenation of the skin, hydrofacial, something to help create some glow to the superficial levels of the skin. Basically, the challenge you have probably heard is that cell turnover, this epidermis, diminishes with age, and so use of topicals and retinols and different things to help further exfoliate the skin but create this nice glow. In our practice, we use hydrofacial a lot, which is a device that it combines microdermabrasion but uses water instead of crystals, and infuses glycolic acids and hyaluronic acid into the skin so that skin has a very nice glow afterwards. So I think that the take-home message is understand the concepts of what will make an impact, figure out what your goal is, your budget is, and if you want to do things in a stepwise way, which many people do. And I think I would say start with the foundation, start with the structure to restore some proportion, and then work your way outward. And I think you'll find yourself in a good place. Meet with qualified, experienced doctors who perform these procedures. Find someone who I think will resonate with your style. It's a very important decision, because whoever you go to, you and the doctor should have a real understanding of or kind of a synergy in your aesthetics, and really have that communication. And don't just chase a certain product or a device or a name or anything. Come up with an idea of the solutions and figure out what works best for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.